Hello viewers, welcome to Health Options, the program that not only tracks government policies on health, but helps you with the information you need to make informed choices about your health. Nigeria is one of the highest contributors to the global burden of maternal and newborn deaths. In view of the disturbing statistics, revitalizing Nigeria's primary healthcare system to help address the burden of morbidity and mortality from pregnancy-related conditions is one project. Special Advisor to the President on Health Matters, Dr. Salma Anas Ibrahim, revealed is close to the heart of President Bola Ahmed Tinubu. That's our focus on our policy track segment as we bring to you Dr. Salma Anas Ibrahim speaking on the nation's state of health care and service delivery. Herbal medicines and natural products have long been used as sources and therapeutical leads for the research and development of pharmaceuticals and are regarded as rich supplies of functional foods and nutraceuticals. Natural products and their structural analogues have historically made a major contribution to pharmacotherapy. The high cost of drugs and increase in drug resistance to common diseases such as malaria, bacterial infections, and other sexually transmitted diseases, experts say, underscore the therapeutic approach to alternative traditional medicine as an option for concerted search for new chemical entities. The core mandate of the Nigerian Natural Medicine Development Agency is to research, collate, document, develop, preserve, and promote Nigeria's natural medicine defined as indigenous or traditional health system. Be part of our nature's canal as we shine the spotlight on natural medicines research and development with the Director General, Nigerian Natural Medicine Development Agency, Professor Martins Emeje, as guest. Thanks for joining us on the program. I am Rabi Abdullah. If you're just joining us, this is Health Options, and we take off with the Special Advisor to the President on Health Matters, Dr. Salma Anas Ibrahim, speaking on the nation's state of healthcare and service delivery.
Especially around the health of women, girls and adolescents in Nigeria, as well as our children. Care of children after under 5 years remains a key challenge. But I want to reiterate here categorically that the President, Bola Ahmed Tinubu, under his leadership, the Renewed Hope Agenda, is committed to tackle the problems of maternal death and morbidity in Nigeria, as well as children under 5 years. And this is a commitment he has made during the campaign, and after the campaign, he has also prioritized that as a vision and also as one of the major priorities in the delivery of the healthcare. Without, as one of us have said, without access to quality healthcare for women, girls, adolescents, including adolescent girls and children, we cannot realize the universal healthcare coverage. And by the way, adolescent girls contribute over 40% of the death that occurs during pregnancy and childbirth, because majority are also adolescent due to several factors that you have raised. So this government is committed. 2 days ago, Mr. President spoke about health, and he did mention that we're going to build capacities of health workers to ensure quality of care. So when it comes to the issue of death of women, we are committed to accelerate improvement of the health of women and children and reduce maternal death to the barest minimum. In fact, zero tolerance to maternal death is what we are promoting in this administration. And most of this death, deliveries by skilled birth attendant, very low. If you look at the trend over the period from 2003 to 2018, the NDHS result, it has shown a drastic reduction in skilled birth attendant. We've seen a slight increase actually around antenatal care attendance, which is over almost 67% from the NDHS of 2018, which is a very long time. And now we're talking about a lot has changed. The impact of COVID was there and several other things, the economic hardship. In fact, the economic hardship is felt most by women accessing antenatal care and also accessing quality deliveries by skilled birth attendants, plus the issues of human resources and capacities. Because most deaths of women, more than 50%, happens at the point of delivery, at the point of labor. So most of the deaths are associated with deliveries and also post-delivery immediately, within 24 hours after deliveries. So the main issue there, that is the crux of the matter, as I said, because a woman can have a good antenatal clinic attendance, but at the end of the day, if she don't have access to quality delivery at the point of delivery, and we know most of the causes are as a result of bleeding, postpartum hemorrhage, which accounts for more than 60% of death of women. And this is bleeding. It's just like opening a tap and then the blood continues to flow. Before you know it, the woman is already in shock. So we must tackle that issue immediately. And that is supposed to be tackled as an emergency. So access to emergency obstetric care and care of the newborn. And if you look at the trend also of our NDCs in Nigeria, we've not been doing well. We are stagnated when it comes to taking care of the lives of the newborns. A lot of them die within the first few hours, 24 hours of delivery, and then within the first month of delivery, and a lot are not even reported. It's because there are lots of cultural misconceptions and biases around the issue, because some others see it also as normal for a woman to die. It's not normal, it's abnormal, because it's a normal physiological process. So no woman should die as a result of pregnancy and childbirth. But what matters is those quality services must be there at the right time in the right places for the women to reach and also access them. So I'm happy you did talk about the ambulance, because these are part of the delays also in transporting the woman. But the first delay, as we always say, is at home, taking the decision even to take the woman to the facility, then the conveyance of the woman, and then thirdly also the quality, the services that are available to address the emergencies. So I'm happy to mention that this administration is highly committed. Nigerians need to know what services are available, where are the services available, and then why do we even need the services? And this is what takes us to think differently with my team and talk about homegrown solutions. Are we really talking with Nigerians about the solutions and the problems? Are they their problems? Yes, maternal health is a problem in a community. Let us identify the key champions and say it is a problem. How do we come up with full homegrown solutions to address the issues? What needs to be done? What are the services that they require in their facilities? How do we continue to train, which we are committed to train health workers to provide the services to women and girls at the right time to reduce maternal death? So we're talking about acceleration. We need to accelerate that to reduce the number of women that are dying. As we're talking today, a woman is either dying or a woman is looking for opportunities to see where they can get services or seeking opinions within her small community to be transported to a facility where she can access services. And at the same time, more children are dying. I think it's almost about more than 500 newborn that die in a day, not even in a month, in a day, more than 500, and most of them are unreported. It's beyond just the health sector. We need more people in finance. We need more people in transport sector to work with us. We need more people in the orientation sector to give the right information to our people in the community. So dissemination of information is very important, and strengthening partnership with civil society and the media.
Up next is Nature's Scanner, as we take a look at natural medicines research and development with the Director General, Nigerian Natural Medicine Development Agency, Professor Martins Emeje, giving us insights into the Nigerian situation. That will be right after these messages. Thank you so much, Professor Martins Emeje, for making our time to be with us on Health Options. It's a pleasure to have you.
It's my pleasure always.
Okay. You know, when I look at the place of drugs, medication in healthcare, it revolves around, it's critical, very, very critical. Why is it critical?
Yes, two things actually are the most critical in life: food and medicine. Once you have food and you have medicine, you are okay. You don't even need anything again. So that's a summary of why it is critical. Now, to drive into medicine particularly, as there is nothing living that does not fall sick. Plants, animals, and human beings. As long as it's living, it will fall sick. And if you're going to fall sick, then you will need medicine. That's why man needs medicine, animals need medicine, plants need medicine. That's how critical drug is. Those medicines we give to plants, or give to animals, or give to man are called drugs, whether they are in the natural form or they are in the synthetic form.
Okay, so that in essence, there cannot be quality healthcare without quality drugs, and not just quality drugs that are available.
Oh yes.
And accessible.
Fact, yes. There's this famous quotation by a one-time WHO Director General who said that without drugs, the healthcare system is without substance and credibility. But because of the status of a WHO DG, it caught fire all over the world, and today it's a reference quotation that we all make, and that is the truth. Because what is healthcare without drugs? So what care are you providing?
Okay, you know, at the mention of natural medicine, big names, countries like Asian countries, yes. India, talking about China, yes. Thailand, yes. Japan, yes. Korea and yes. all of that. Yes. They readily come to mind. And I look around and I see how richly blessed the yes. African continent is. Yes. And I'm asking myself, where are we? Why are we so glaringly missing?
By God's grace, in the next 2 years, they will mention our name also.
How?
That's the vision.
How is that going to be?
They will mention our name. You see, because for me, because we didn't prioritize it. That's why we are nowhere to be found. Government couldn't have established a research institute like the one I heard right now, the Nigerian Natural Medicine Development Agency, and then we won't do anything. No, now. Okay, what do you want again? Government has established a research institute. They have National Assembly passed bill. President of Nigeria signed the bill. It became law. We are the only research institution in Nigeria giving law. So government has given law to back up the establishment of a research institute to deal with this natural medicine. When you hear about Asian countries, and today it's not just Asian countries, because the UK, United Kingdom, monopolized the herbal market in 2022, 2023. Oh yes, but people don't know. As I'm talking to you now, on 21st of this month, the UCH, University College London, UCL, they have a huge webinar, international webinar, on the role of herbs in healthcare delivery system. And somebody will be here in Nigeria where all the herbs we need for all the diseases are available, and we are still asking questions. Didn't you see that King Charles said that is what he's going to take for us, and the thing has gone viral everywhere now? So if UK is now having conferences on the role of herbal drugs in their own healthcare delivery system, we have already drawn a roadmap on how we are going, and we are pursuing it vigorously. So you are going to see how we develop our own herbal medicine.
Okay, you know, I look around and I see bitter leaf in gardens, around environments, and with the information that even in the US, United States of America, bitter leaf is now being formulated into capsules yes. and sold out.
Yes.
It's medication.
Yes, that's true. So bitter leaf is imported. Bitter leaf capsule is imported into Nigeria now. And we are the owner of bitter leaf. Bitter leaf, we all grew up to eat bitter leaf in our soups, isn't it?
Yeah.
You know, I am in the Ministry of Innovation, Science and Technology. This is an innovation matter. This is science. This is science. This is technology. Okay? You know, health is science, but science doesn't have to be health. Just did a community engagement meeting in covering the northern Nigeria. That community engagement meeting was meant to interact with the people that will be the users of the outcome of our research. You see, the right way to do research is to do research that will be useful to the community. It is called community-driven research. You go out to have meeting with the community to tell them that, look, we are about to undertake research to develop a new anti-malaria product. You discuss the protocol of your study with them. You tell them what is involved in the study. You tell them their own roles in the study. Then you tell them that eventually, when this study is concluded, this is the expected outcome, and this is what it will add to the community. So what we are trying to do in collaboration with our colleagues, 5 countries, Nigeria, Uganda, China, UK, and India. 5 countries are collaborating. We are all researchers. The principal investigator is from UK because we are seeking funds. It's competitive research proposal that we did, and we are seeking funds from the UK government because UK government is very interested in developing herbal medicines right now. So they are also interested in supporting countries that their scientists are interested in development of herbal medicines. So we have keyed in. Now in Nigeria, the Nigerian Natural Medicine Development Agency is leading the group. The Nigerian group is made up of Nnamdi Azikiwe University, Oka, led by Professor Charles Simone, the Vice Chancellor, while the Obafemi Awolowo University is led by Professor Ibrahim Bello. He's a seasoned clinician, you know. So we are a group of scientists, therefore, that we are into this. So we are out now into the different geopolitical zones in Nigeria discussing this research. So we engage everybody from the commonest, for the purpose of this discussion, the commonest person in the community to the highest person in the community. Users of herbal medicines, communicators, that's journalists, clinicians, that's medical doctors of all specializations and specialties. Then we also have associations of the traditional medical practitioners and industry players in the herbal area. We invited traditional rulers. We took our community engagement meeting to the grassroots. So that's what our community engagement was all about. We are covering the entire country. We are done with the north. With this is limited for now because of funding, and then we are going to the southwest. It's holding in the Ile-Ife, and then to Oka in the southeast. So that's how we are doing. At the end of the day, we synthesize all of this as part of our submission to the funder, in order to get the grant.
To know just how committed is the federal government, especially when it has to do with taking ownership of driving natural medicine production and production and making it available. If you understand what
this country, our forebears have seen that it is necessary for us to develop our own natural medicine. Otherwise, they wouldn't have established an agency that they spent resources to get Establishment Act for it, called the Nigerian Natural Medicine Development Agency. That is on that. We need presidential intervention. Check other clients that we are quick to reference. The private sector is very active in this area, in research and development, very active. They donate huge funds. They create foundations in research institutions. So when product, and they benefit from it too, because they have the first right of refusal in outcome.
Okay, as we round off, can you let us into some of the products Nigerians should look forward to by the mandate of your agency?
Yes.
And with this
Yes.
renewed energy.
Malaria
Okay.
is the biggest problem that we have. And by the way, we are the owner of malaria in the world. So malaria medicine can never be enough. We must make malaria medicine available in abundance,
And you intend to
such
do
that people will have options. Okay. Yes, we intend to do that. We gave ourselves 6 months. We are already meeting our targets. Diabetes, which is an imported disease. I call it imported disease because it is lifestyle. Erectile dysfunction. Erectile dysfunction is one of the biggest problems right now. We have our products, and these products and these disease areas I'm mentioning, we already have products that we have scaled through NAFDAC's approval, listing registration approval. Okay? Arthritis is medicine for the aged. We have one of the best products for arthritis in the world, as I'm talking to you right now. There's no disease anywhere in the world that the solution to that disease is not in that place where that disease is. It is nature.
We understand nature at the NTA, and that's why we have this program. And look at our environment anyway.
Yes.
Look at our
fine
environment. The greenery.
Yes.
Greenery. It
Yes.
shows that we understand nature.
Yes.
Here at the NTA.
I mean,
And,
totally.
Thank you so much, Professor Martin Sameja, Director General, Nigerian Natural Medicine Development Agency, for spending time with us on health options as we continue to, preach the need for Nigeria to look inward and build up its natural medicine potential for the benefit of the population. Thank you so much for coming.
Thank you very much for inviting me.
For research and development in natural medicine to thrive in Nigeria, some health watchers argued that a more collaborative interaction among multi-level public and private sectors, improved research, infrastructure, and political will at the highest level are needed to transform rich natural resources into products for better health outcomes for the populace. This is where we end this episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. I am Rabi Abdullah. Remember to do good and stay safe.